Hi Blood Talk fams, we are back for another episode in Blood Bank. We are going to be talking about antigen typing. I will include purpose, how to choose the control cells, and interpretations. Without further ado, let's get into it. What is antigen typing? Antigen type is a test that we do to determine the antigens on patients' RBC using various antisera. Why knowing patients' antigen type is important? As blood bankers, we need to know patient antigen type in order to select a unit for a compatibility test before giving it to a patient, especially when the patient develops a specific alloantibody. When would antigen type be beneficial? There are a few situations that performing antigen type would be useful and helpful for the patients. 1. The patient have a history of alloantibody and/or we do not have the patient record. 2. When managing hemolytic disease of fetus and newborn, we can perform antigen type on mother and father, which can be useful to predict the chances of neonate or fetus occurring a particular antigens and allow for monitoring. We talked about when antigen type should be performed. What about when antigen type should not be performed routinely? We should avoid or be conscious about performing antigen types on recently transfused patients. Transfused RBC can be circulating in the patient's circulation for about 3 months. If we test the patient blood within that window, we will have a mixed populations of both the patient's own RBCs and the donor RBCs that's mixed in with the patients. If the antigen type performed during this time, it may be wise to repeat after 3 months has passed. Another situation is when the patient was recently transplanted, especially bone marrow transplant. When the patient has a bone marrow transplant, the patient blood type could change and the antigen on the patient red blood cells could change as well. How we properly choose the correct cells for positive controls and negative controls. We perform quality control by making sure that the antisera is working properly. That's why we do the controls. Without a proper control process, we cannot tell the negative reactions is from the deteriorations of the antisera or from the absence of the antigen. With that in mind, which cells would you choose for the positive controls if you are testing JKA? Out of these two cells, which one would you choose as the positive controls? Is a good controls is those with heterozygous or homozygous expressions? That's correct. A good control would be heterozygous expressions of the antigens for the one that we are looking for. Why do we want it to be heterozygous when we only use homozygous cells during antibody identifications? Well, we want it to be heterozygous because we want to make sure that the antisera will be able to detect a weaker expressions. Now, let's choose a negative control. The theory why we perform a negative controls is the same as the positive controls to make sure that the antisera is working properly. So, out of these two cells, which one would you choose? Yes, you would want to choose the cell that lacks the antigen that you're looking for. I don't include step by step here because each antigen and each manufacturer have a different procedures on how to perform. So just follow the insert. Auto control. What is an auto control and why do we do it? Auto control is when we use a patient's serums or plasma to react with the patient's own red blood cells. This is to make sure that the positive reaction isn't coming from the patient's spontaneous agglutination. Interpretations. Given that the positive and negative controls work, agglutinations of the red blood cell indicates the presence of the test antigen. If the controls don't work, you will have to repeat the test. That's all I have for today. Did I miss anything? If you have any questions, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time changes, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!